Good evening. I'm Kelly Gare-Ripken, National Chair of A Women's Journey. On behalf of Johns Hopkins Medicine's A Woman's Journey, thank you for joining us this evening for our monthly webcast series, Conversations That Matter. A Woman's Journey, as you know, strives to improve your well-being through health education. According to Grand View Research, the global mineral supplements market size was valued at $48 billion in 2021 and is expected to expand at a compound annual growth rate of 2.4% from 2022 to 2030. However, a 2019 analysis presented by Johns Hopkins Medicine and published in the Annals of Internal Medicine proposed that consumption of most vitamins, minerals, and other nutritional supplements cannot be linked to protection from heart diseases or to a longer life. Tonight, we are so pleased to be joined by Johns Hopkins internist, Clinical Director of the Division of General Internal Medicine and Medical Director, Johns Hopkins Executive and Preventive Health Program, Dr. Bimal Ashar, to learn why people take supplements, when they may be helpful, and the potential to cause harm. So please use the Q&A on your screen to ask your questions this evening, and Dr. Ashar will respond to them during the last 20 minutes of tonight's program. Our webcast will conclude at 8 p.m. tonight. I want to take this opportunity to acknowledge and thank Johns Hopkins University's program Hopkins at Home for their production assistance, and you can visit their website for additional lectures and courses throughout the year. And now I am pleased to welcome Dr. Ashar.
Thank you, Kelly, and thank you to A Women's Journey for inviting me to speak to you all this evening, and thank you for spending your time with me this evening. So before I get to specific supplements, some of the supplements that I get asked about and discuss with patients a fair amount, I did want to have a general kind of comment about my philosophy regarding both drugs and supplements. I'm a minimalist. I don't like drugs. I don't like supplements in general. They have their roles. We need drugs for certain conditions, and we need to in order to get better, we need to take them. But I'm not a big pill person in general. So that's my disclosure to you all. And I'll tell you, my reasoning is very, very simple. And, that is, we have millions of reactions going on in our bodies all the time, right? And the idea that taking a medication, a supplement or something like that is all of a sudden going to, and you'll see a lot of advertising for this, restore balance, right? That somebody somewhere knows that you taking this one pill is going to restore all those imbalances that you have in your system, I think is either false advertising or just naive. So that, again, is my general rule regarding both supplements and drugs, and realizing that we know very well that drugs have their own problems, right? So they can help us and they can also hurt us. And that's why there's that long list of adverse events that you need to anticipate when you see those TV ads for any drug that's out. But there's also probably a list of side effects that supplements can cause that we just don't know about because they're not studied as well. So before I go on, so Kelly mentioned that that the supplement industry is huge. It's around 50 billion in the US and in the hundreds of billions worldwide. Probably well over 50% of Americans take supplements, and some of the newer estimates after COVID is over 80% of patients may be taking supplements. But why do people take supplements? So, is it to live longer? And if that's the case, well, we certainly have no evidence that any supplements make us live longer. We wish we did, but we don't. To prevent illness, we wish we also had good data to say that supplements and vitamins or vitamins help us live longer. To treat a disease or condition, and this is where we get a lot of little evidence that some supplements may actually help in certain cases. And we'll talk about a few of them in a little bit. But we also take supplements to make up for something we're not doing, like exercising or eating a balanced diet. And we think that popping a supplement may kind of make up for that. Or it'll make up for something that we're doing to ourselves. And I like to use this example a lot because, you know, it's been a challenge for me. I have a patient who I've known for probably now 18 years or so, and he drinks a case of beer every weekend. Doesn't drink during the week, but every weekend will drink a case of beer. But what does he do? He takes milk thistle, an herb that's thought to protect your liver, every day because he knows he's causing harm to his liver, but he's thinking he's protecting himself. And so he'll take the milk thistle to make up for what he's doing to his own liver, which, by the way, there isn't any evidence that doing that will actually protect your liver from the toxic effects from alcohol. And then the final reason why I think in general that we take supplements is to compensate for something we've also been told not to do. So for instance, we're told not to go in the sun, right? Because you're going to get skin cancer. And so we don't get enough vitamin D. So maybe take a vitamin D supplement. And I'm going to talk about vitamin D in a little bit as well. And so why are supplements really popular? Well, this is kind of why we take them, but they're also popular because, you know, they do give patients a feeling of taking control of your own health, right? Most of my patients will know a lot more about the supplements that they're taking than I do. And a lot of times I'll have to look them up either during the visit or after the visit because I never heard of what they're taking. And so, so it does give you some power, and taking control of your illness is actually a good thing. They're easily accessible. They're over the counter. You don't need a prescription. You don't need to go to anybody. You just walk into the pharmacy and you can get what you want. They're thought to be natural, right? And the idea that natural is better. The only caveat I have to that is that remember that most or about a third of the drugs on the market today are made from natural substances. They're purified, but they're made from herbs and other natural substances. And so drugs are, in a lot of cases, the same as natural supplements. Other people may say, oh, it's part of my tradition to take these supplements. And I can also give you an example that I remember when I was a child, my mother used to give me these pills that she would get from India. And, you know, I would have a fever or something and she'd say, oh, take this. And, you know, many years later, I said, hey, you know, what was I taking? You know, and she had absolutely no idea, you know, what I was taking. I said, well, that's what you take when you have a fever. But, you know, for all I know, I was, you know, taking lead. I don't really know. The other reason why we take them is that, you know, we've done a very poor job in medicine in coming up with preventive medications. And we all want something, right? We want something to help us prevent illness. And in the medication sphere, we really don't have that, right? Something that'll prevent illness and not be toxic to us. And we don't have them. The other thing that we have to always think about, and this goes back to the dietary supplement industry, is advertising. And, you know, there are a lot of catchphrases that are used to sell supplements. Doctor recommended, and I can tell you there have been cases where the doctor that was recommending a heart supplement or an eye supplement was actually a podiatrist, a foot doctor, right? So, you know, the term doctor can be anything, right? Anyone who says that they're a doctor, a PhD of anything can be called a doctor. And there have been cases where they've used people who actually aren't physicians to make those recommendations. Clinically proven is something you see with a lot of advertising, right? So the problem with this is that there's actually no definition of what clinically proven is. And this is a problem. Clinically proven in my mind means, okay, something was actually scientifically evaluated, tested by the Food and Drug Administration like drugs are. That to me is clinically proven, but that's not the case with dietary supplements. You'll see phrases like emerging research suggests, where they use general kind of basic science research to say that the supplement that they're selling really is going to save your life or prolong your life or do something for you. And then consumer testimonials, right? Testimonials from people who've taken the supplement, from celebrities. You see that a lot with these supplements. And speaking of celebrities, there'll be celebrity kind of pseudo endorsements. And there's something in the supplement industry and known as the Dr. Oz effect, that if Dr. Oz mentions a product or if a company gets to put their representative on his show and they mention the product, the sales go up by something like 12,000%. Well, now he's going to be running for Senate, so he's giving up on that. So and Dr. Oz has done a lot of good things with respect to health and wellness, but supplements have not been one of those. Although he does not on his show, he would not come out in favor of any one specific supplement, but he will use hyperbole and exaggerate what some of the supplements were doing. So when we think about supplements, it's really important to know about how supplements are regulated. Before 1994, there weren't many supplements on the market. Most of them were vitamins. And if you were going to get something like an herb or something on the market, you actually had to prove with pre-market testing that it's safe or effective or both. But in 1994, the Dietary Supplement Health and Education Act was passed. And that really expanded what a dietary supplement was defined as. And all of a sudden, it includes herbs, biologics like certain hormones, in addition to vitamins and other things. And that act made it so that no testing was necessary before you market a supplement. You didn't have to test it for safety or for effectiveness. You couldn't make a treatment claim, though. So you couldn't say that this supplement treats Parkinson's disease. You could not say that, but you can say this supplement supports your neurologic function, or take this supplement for your immune health. So those things are okay, but you can't make a disease claim. You do need to put a disclaimer on if you are marketing a supplement saying that these statements have not been evaluated by the FDA. Usually they put in very, very small print at the bottom of any ad. Really, you and I can get a bunch of supplements, a bunch of herbs, we can put them in a bottle and market them tomorrow and start making money without actually having to show any sort of efficacy or safety. It's really up to the Food and Drug Administration to prove that a supplement is unhealthy or dangerous or ineffective in order for them to try to remove it from the market. And many years ago, some of you may remember there was a supplement called Ephedra. Ephedra was used a lot in weight loss supplements. And if you combine it with caffeine, it actually, there were a number of small studies that suggest that people could lose weight with ephedra and caffeine, that combination. The problem is that it's a stimulant, and so it raises heart rate, raises blood pressure, and then over time there were documented deaths and strokes and heart attacks due to the fact that people were taking these supplements. But it took the Food and Drug Administration over 7 years to actually get it off the market from when they first got those reports. So it's a very long process to try to get a supplement off the market. And so safety is a big, big concern, especially with certain categories of supplements, including the weight loss supplements, anything that can be a stimulant of any sort. But, importantly, do supplements work? I've pulled out this quote from the Dietary Supplement Health and Education Act back in 1994. And one of the reasons why the act was passed and expanded was that for this reason, that appropriate use of safe nutritional supplements will limit the incidence of chronic diseases and reduce long-term healthcare expenditures. Well, it's been almost 30 years, and can we say that it's done any of that? And we know that more than half of Americans take dietary supplements. But what have we seen? We've seen the incidence of chronic disease go up, and we've seen healthcare expenditures go up. And so in and of itself, it really has not done anything to improve the health of the country. Now, it has improved some of the financial health of certain people and certain companies, but it really has not done anything for overall health. Now, the supplement industry would tell you that, well, that's because people are taking the wrong supplements. The problem is there's no guidance on really what the right supplement is, because most of it hasn't been tested, certainly beyond very short-term evidence. Actually, I'm going to go back. I'm going to stay on this. So are supplements safe? That's the important thing, right? So, okay, if I'm taking a supplement, really the harm could be, as long as the harm is just me spending money, maybe I'm okay with it if there's the potential benefit, but I want to make sure that it's safe. A few years ago, the Centers for Disease Control published a study that showed that there was about 23,000 emergency room visits per year and about 2,000 hospitalizations per year because of dietary supplements. Now, yeah, that sounds like a lot, but with the number of people taking dietary supplements, actually not that huge. And compared to probably the number of ER visits and hospitalizations due to drugs, it's actually probably a lot smaller. So most supplements are probably safe in the long term. What we don't know is about what goes on in the short term, I'm sorry. What we don't know is what goes on in the long term. And we have no data on the long-term effects of dietary supplements. The other problems is that the labels of dietary supplements are often unreliable. So they may tell you there's an active ingredient in there, but there may be nothing. And many years ago, Consumer Reports did a study of ginkgo biloba supplements, and they found that some of them had actually no ginkgo biloba, and some of them had 10 times the concentration of what they actually said was in it. And so it's kind of all over the map. There's also the potential for supplements being adulterated with heavy metals and medications. And so there were cases where, people want to sell their supplements. So they put, for instance, in some erectile dysfunction supplements, they put a little bit of Viagra in there that you don't notice. And hey, it seems to work a little bit, right? So there are cases of that. And I like to tell a story of one of my favorite medical students that I've ever worked with. And she came to me and she said, hey, I saw this patient that I had admitted to the hospital, and they ended up having lead poisoning. And I said, wow, lead poisoning, that's, how did they get it? Because it's not very common nowadays to have a case of lead poisoning. And she said, well, he worked in inner city Baltimore, and he stripped houses. So we thought it was all because of lead paint that he was being exposed to. And then I went on and I said to her, do you know if he was taking any supplements? And she said, he said he was. And I said, well, is it possible that you could get those supplements? And so she was, again, fantastic medical, just so incredibly thorough. She called the patient, she met the patient, at a restaurant and said, hey, can you give me some of the pills that you were taking? And he was taking these Ayurvedic supplements that he got from the internet, off the internet from India. And she brought them to me, and I sent them down to the lab here at Hopkins, and I had them analyze 3 different pills that they gave. Every single one of them had a significant concentration of lead, and actually one of them was pure lead. And that's how he got lead poisoning, not from stripping houses with lead paint in Baltimore. So this can occur. The other thing is herbs can be misidentified, and there have been cases of the misidentification of herbs causing really toxic herbs being included in supplements that have caused things like kidney cancer in patients. Again, rare, but it does happen. And then we always have to worry about, if we're taking medications, about interactions with supplements, especially if you're on things like blood thinners or blood pressure medications or things like that. So always need to take that into consideration when taking supplements. I'm going to switch gears a little bit and talk about specific supplements. And the first thing and probably the most popular supplement that people take is a multivitamin. And most recently, the United States Preventive Services Task Force came out with their recommendation on multivitamins. And they basically said that there is insufficient evidence to say that multivitamin supplements help with the prevention of cancer or heart disease, or anything else, to be honest with you, as far as preventing disease. And so they just came out with this insufficient evidence statement. There have been a lot of studies that have been done. Multivitamins have been popular for many, many decades. But none of those studies have actually definitively shown a benefit. Now, it's a different story if you are someone who has a terrible diet and do not get nutrients, then probably getting nutrients through supplements is a reasonable thing to do, but you really want to get it through food if you can. The second supplement that I talk about probably the most with patients is vitamin D. And as most people probably are aware, the vitamin D promotes calcium absorption to improve bone strength. It also has a role with immune function, although it's a little gray on really how it works. We get vitamin D from UV rays, from sunlight that strikes the skin. We get very little vitamin D from tanning beds, so that is not an alternative. The recommended daily allowance of vitamin D is somewhere between 600 and 800 units of vitamin D per day. For the older you are, probably you want to err towards the higher dosage of that. With vitamin D, and the reason why supplements are often recommended is that it's very difficult to get from food. You know, salmon and trout may have some vitamin D in it, and actually may have a significant amount, maybe 500 to 600 international units per serving. But most of us don't eat fish every day. And, you know, if you did, you also have to worry about mercury toxicity with, you know, mercury in fish. So we typically talk about having 2 fish meals per week. And so probably don't get enough through fish. Mushrooms actually do have about 300 IUs of vitamin D per serving. So not a bad way to get a little bit of vitamin D. And then milk and cereal are fortified with vitamin D, but we're talking about 100 to 200 international units. And then egg yolk has a little bit of vitamin D as well. Those are really, you know, other than foods that are fortified with vitamin D like milk, I mean, those are really the products that we can get vitamin D through diet. And that's why supplements are typically recommended to get to your recommended daily allowance. I will make a mention here about vitamin D3 versus vitamin D2. This is another question that I'll get. Probably vitamin D3 supplements are better absorbed, and there's more data on it having a more lasting effect on your vitamin D levels than vitamin D2. So if you're going to choose between the two, I probably would say D3 more than D2. You know, with vitamin D, there have been a number of studies that have suggested that people with low vitamin D levels have a higher incidence of lung disease and heart disease and all these other diseases. You know, what we're seeing now is studies being done to say, okay, well, let's take vitamin D and let's treat these patients, and do those things improve, or do we prevent those things? And to date, there have not been any good studies to suggest that vitamin D does anything in and of itself to prevent any of those diseases or treat those diseases. And in fact, even with bone health, there's really no evidence that vitamin D prevents fractures in and of itself. So we do need it for our bones. And so certainly if you're being treated for osteoporosis, you should take enough vitamin D so you improve their calcium absorption. And it works well with if you're taking a medication for osteoporosis. I'm going to move to vitamin E because it's very similarly. So many years ago, vitamin E was thought to be the cure for heart disease, that low levels of vitamin E were associated with heart disease. And all of a sudden, all these big studies got done on giving people vitamin E supplements. And they said, oh, wait a second, you know, vitamin E doesn't actually improve heart attacks or decrease heart attacks or decrease heart failure or anything like that. It actually has no effect on heart failure. And no effect on preventing any sort of cancers. And then some studies were done a little bit later. One of those studies were done by one of my colleagues here at Hopkins, where they looked at a bunch of studies that were done on vitamin E, and they looked to see, and they said, wait a second, you know, actually people took higher doses of vitamin E, died sooner than those who did not. And so there may actually be a negative effect of higher dose vitamin E. So don't take vitamin E in high doses. Similarly, studies with beta carotene suggested that patients who smoke and take beta carotene had a higher incidence of cancer and heart disease than those who did not take beta carotene. And beta-carotene is thought to be this really potent antioxidant. And when the first study was published that suggested that, they thought it was a mistake. And so other studies were done, and the same thing was found, that it actually increased the risk of certain cancers and heart disease in patients specifically who smoke, not so much in those who did not smoke. And so this really is a conundrum, right? And so we talk about antioxidants and, antioxidants are good, so I should take more antioxidants. But there's a term called the antioxidant paradox. And the idea is that, yeah, antioxidants are probably do lead to certain diseases, but antioxidants also probably serve a positive function in the body. And so by loading yourself with antioxidants and getting rid of those oxidants, the oxidants probably have a positive effect in the body. So if you load yourself with a bunch of antioxidants, you may actually overshoot, and you're now suppressing some of the positive effects of the oxidants in our body, leading to disease in and of itself. And so that's the antioxidant paradox. And so taking high doses of anything is something that I really don't recommend. I mentioned vitamin D earlier. Similarly, calcium is something that is recommended. Now, we used to say, and many years ago, some of you your doctors may have told you, oh, take 1,800 milligrams of calcium a day. That's good for you. And then there were some studies done that said, what? Probably taking a bunch of calcium supplements may not be the best thing for you. It may increase your risk for kidney stones. It may cause constipation. It can decrease the absorption of medications. It can potentially increase the risk of heart disease, although there's a lot of controversy about that right now. But I would say that the party line right now with calcium is that we should get somewhere around 1,000 milligrams a day, maybe up to 1,200, especially if you have osteoporosis. And try to get as much of it through diet. And, these are some sources I put on the slide of dietary sources of calcium. It is possible to get close to that 1,000 milligrams daily with calcium, as opposed to with vitamin D. It's much, much harder. I will also mention something that is starting to become more in vogue, and that is to ground down eggshells and prepare them into a powder that you mix into a little drink. And eggshells, half an eggshell probably has somewhere around 800 to 1,000 milligrams of calcium in it. And so I've had, I know some of my OBGYN colleagues have told their patients with osteoporosis, this is a good way to get your calcium. Not a whole lot of studies being done on this, been done on this. There have been a couple of studies on it, but I just throw that out there for those of you who want to search the internet for eggshell preparation recipes. A couple of the supplements I'll talk about quickly before I conclude. Zinc is one I do like to talk about. Got a lot of press with COVID. It's thought to have a role in a number of cellular activities that go on, specifically with the immune system. Food sources of zinc include oysters, poultry, nuts, beans, and a number of meats. There have been a number of studies that have been done over the years, none of them huge, but small studies that were done that did show that it may decrease the duration of the common cold. So, which is, again, very common. And so you get the sniffles, you take the zinc supplements early, you may actually decrease the duration of the cold by anywhere between 1 and 2 days. So there's a few studies that actually show that. And that's why you do have a number of supplements on the market, zinc lozenges and things. You should stay away from zinc nasal sprays because that can make you lose your sense of smell. There actually have been a few studies that have been done on zinc with COVID, and they took patients who were not really sick with COVID, but had an early case of COVID, and they gave them zinc and or vitamin C and followed them out, and they found that they actually did not decrease the duration of COVID, duration of symptoms from COVID, or decrease hospitalizations or anything like that. So the early data is that it probably doesn't have a huge effect on preventing or treating COVID. I'll mention coenzyme Q10, which again is a very popular supplement that's been, touted to help prevent heart disease, high blood pressure, migraine headaches, or treat migraine headaches, treat Parkinson's disease, treat muscle problems from statin drugs. And unfortunately, most of the data is conflicting. There have been a few small studies suggesting positive effects. There have been a few showing not positive effect, nothing that really showed a huge harm. So it's probably pretty safe. But the doses are all over the place. For instance, most people, when you go in and you take a coenzyme Q10 supplement, you're getting about 100 to 200 milligrams a day. The studies done with Parkinson's disease were on the order of 1,200 milligrams per day. So really, really high doses of coenzyme Q10. And so not sure that it really has been shown to do a whole lot. The other couple that I'll mention, one is glucosamine. The reason why I do talk to patients about glucosamine is that we've really done a very bad job with arthritis, right? I mean, we don't have a whole lot for arthritis pain. We tell you to take a bunch of non-steroidal anti-inflammatories, which can tear up your stomach and cause kidney disease. But we don't have good medications. And that's where I'll have more of a leeway in saying, you know what, maybe you can try something like glucosamine. The European guidelines on treatment of osteoarthritis, the main type of arthritis, in their guidelines, first line is a crystalline glucosamine sulfate, which in Europe is prescription. It hasn't made it into the guidelines in the US, but I will say that it is considered first line in Europe. Along with chondroitin, it is also considered first line. It probably is pretty safe. The studies really haven't shown significant side effects from it. It may interfere with blood thinners, so you need to be careful. Staying on the arthritis theme, the other thing that I think a lot of people are turning to now is turmeric or curcumin. That's a plant from the ginger family used in a lot of Asian cooking. It is thought to have anti-inflammatory, antibiotic, antidepressant properties, been posed as a treatment for COVID. With arthritis, there's a little bit of evidence that it helps. And I will tell you anecdotally, I do have some patients that swear by it for their arthritis. And so I don't have a problem with people trying. Do keep in mind that it can cause some gastrointestinal upset. I've actually had a couple of patients where it does look like that it may decrease iron levels. And so I've had a patient where it actually caused iron deficiency anemia. And so being careful about those things, especially with higher doses, is important. And really talking to your doctor about what you're taking. And my general rule with these supplements is take them for 8 to 12 weeks. If it doesn't do any good, don't waste your money. The last one I will talk about, because this is another one I get asked about a lot, is Prevagen, the memory supplement. It's advertised as a memory enhancer. The active ingredient is thought to be this apoequiporin, which is found in jellyfish, which I'm not sure why that's a selling point, but there have been a number of class action lawsuits against Quincy Biosciences, who manufactures Prevagen. The scientists will tell you there's absolutely no way that this protein can get broken down. I mean, it can cross the blood-brain barrier to help with memory because it gets broken down into the stomach into completely inactive ingredients. The other thing that they talk about is how the clinical tests that they talk about it being clinically proven are completely biased. And in fact, if you go to their website and you go and you scroll through and you find the clinical studies, the first line in there is that no statistically significant results were observed over the entire population of the 218 adults that they tested. And so what they ended up doing was then they broke down all those adults into little groups and they tried different tests on them. And they tried to find the few tests that they could find something would end up showing a benefit by chance. And that's what they're calling clinically proven. If you actually look at the study in more detail, there's actually some things that it showed that people who took the Prevagen did worse on with respect to memory, but they don't talk about those things. And so I do think that it's a waste of money. So my take-home messages here, because I think I'm at time, is that I don't have a problem with dietary supplements in general, but realize that they are part of big business. They are a burgeoning industry, and they, just like drug companies are trying to increase profit margin, that's exactly what dietary supplement companies are doing. Remember that product approval is not needed prior to marketing of most supplements, that most supplements are probably safe in the short term, but contamination and adulteration do exist. For most supplements, there's very limited evidence to support their use, especially again in the long term, and some of the existing evidence is conflicting. And that if it sounds too good to be true, it probably is. And this is why I tell everyone, get to a point where you're active, you stick to a healthy diet, you can control your weight, you avoid all your toxins, avoid excesses, manage your stress and sleep. And if you can get there, if you want to muck around with supplements for prevention, go ahead. Thank you very much.
Thank you, Dr. Ashar. Wow. That's a lot of powerful information there. It was wonderful. So also just one quick question. So would you say that most of the supplements are not FDA approved?
Yes, really in and of itself, no supplements are really FDA approved. If they go for FDA approval, then they actually can be marketed as a drug. I
see. Okay. All right. Well, we have a lot of questions, so we're going to dive right in, if that's all right.
That's great.
Okay. This is from Sue. What should you do if your doctors give you conflicting information about taking vitamins? Like one says to take it, and then another one of your doctors says, no, you don't need to take that.
Yeah, so I think the big thing in my mind is to ask the doctor that's telling you not to take it why they don't want you to take it. Because if there's a specific reason, for instance, they're concerned about a drug interaction or a potential side effect, you want to know that, because that is much more than I just think you're wasting your money, right? So if they're telling you, no, I don't want you to take it because I think you're wasting your money, then the choice is yours. But if they're telling you that because they think that there's a potential for harm, then I would listen to that and then do your own research as well. Honestly, most physicians are not well versed in having discussions about dietary supplements. There's just a lot out there. And so when patients bring stuff to physicians, a good physician will actually take the time to look it up and try to discuss it in a meaningful way. Right.
So with that, how do you know which vitamin, the format of it, capsule versus tablet, chewable versus gummy, it sounds like they're just trying to make one more appealing than the other. I don't know if that has any difference, but someone would like to know, is there a difference between any of those formats?
Yeah, so that is a great question. And, the gummies, boy, I think I had given a bottle of calcium gummies to my mother-in-law, and she started just popping them like candy. I was like, no, you cannot do that, okay? So the gummies are the newest thing on the block. And, it's interesting that one of the companies that makes gummy vitamins actually did a study that suggested that gummy vitamin absorption was better than a specific type of pill absorption as far as levels go. But it was very biased studies, and they did it with the gummy vitamin Ds and another gummy, I think, I forget what the other supplement was. The bottom line with all these supplements is that they can all raise levels. Gummies can raise levels, and gummies in some people can be more tolerable. The benefit for true tablets and pills is that typically it can be a slower release formulation, that you can get more supplement ultimately in the pill that can be distributed throughout the body. Some of the problems occur with digestion. So if you have a problem with digestion, there are times where some people may not actually digest the pill or the capsule even at all. They won't even break down the capsule because they may be taking a acid reducing pill or something that doesn't break it down. So they're not getting the absorption that way. And it's interesting. There's an entity called Consumer Lab, and it's one that I do recommend for people who are looking at lists of supplements, because they actually test supplements, and they've actually done studies along the lines of capsules and tablets and supplements, and they do say that in general, tablets do have a better long-acting release of the supplement, but in certain people, that was not found, and actually gummies and liquids were actually found to be better because those people had a problem with absorption.
Interesting. Well, that's kind of good news, because I think maybe gummies might taste a little better.
I do need to add that, remember, that a lot of these, your dentist will tell you do not take the gummies, number one, because it's about 2 to 8 grams of sugar. And if your daily intake is supposed to be somewhere under 30 or 35, then you really blew a lot of it on a gummy vitamin. So
right, which gets to the point that you've said earlier during your presentation, that you really have to be careful what you're taking, because if somebody is a diabetic and they're taking, gummies, not realizing, or anyone really realizing that it doesn't have has so much sugar in it, it could be a potential, problem. Not realizing that, oh, wait a minute, I am putting so much extra sugar into my body right now, and
absolutely,
without even realizing it,
Yeah, they think they're doing a good thing, right?
Yeah. So it really does take a lot of investigating before you if you're already taking medicines, before you go and take these supplements. So on that note, we have a question from Shakira, and she'd like to know, what about collagen supplements? Are all collagen supplements the same? And is there medical evidence to support taking it? And the last part of the question is, do they interact with any other medicines?
So I will tell you that we are very, very early in the collagen supplement studies wise. There have been a few studies on collagen suggesting an improvement in skin elasticity and hydration of the skin. But there's been a little bit of problem with the way those studies were done, and a lot of debate about that. From what we know so far, there does not seem to be significant drug interactions that we know of, or significant side effects other than some gastrointestinal stuff that with collagen supplements. But I don't think there's been a study that's been done for over a couple of months. So nobody knows what this means in the long term as far as taking the collagen supplements.
Mm-hmm. That's interesting, because, this is a really hot, popular supplement right now. I mean, everywhere you go, or anytime you turn on the TV or anything on social media. So that's very interesting what you just said. Okay, our next question is from Barbara, and she would like to know, does magnesium play a positive role in maintaining good health?
Yeah, that's another good question. Magnesium is a very popular supplement, and so magnesium's also been studied for in a lot of ways, and really has not been shown to be preventive in any way. It's also been used for the treatment of things, including asthma attacks in the past, including heart attacks, giving intravenous magnesium. And whereas some initial studies suggested that, it may have a benefit, in the long term, it has not. Two things to be careful with magnesium is that, number one, if you have kidney issues, you do not want to be taking magnesium supplements without discussing it with your doctor, because you can get toxic with magnesium, and that can actually cause heart problems. And number two is that magnesium supplements can induce diarrhea. And so, if you think about it, milk of magnesia and magnesium citrate are laxatives. And so it can induce diarrhea. Where I think a lot of people, at least a lot of my patients, have used magnesium with some benefit has been with things like muscle cramps at night. Taking a little bit of magnesium, they say, they found that it might help them. My big, whether it's homeopathic or whatever thing is, I just tell them to take a teaspoon of pickle juice at night and see if their leg cramps improve.
Oh, you can do that. That actually would work. Pickle juice.
It's actually now being, I was in I think I was in Sprouts, the supermarket, and people are marketing pickle juice in a bottle for that reason. So
Right, right.
always a way to market.
Yeah. Well, that's not a bad way to do that. I like the pickle juice, sounds okay. So here's our next question from Katie. Is asking, please speak about calcium supplements, and does it increasing the risk of heart disease?
Yeah, so this is something that I think there's been a lot of backtracking on. A few of the studies done that made a lot of headlines were studies where they actually looked at heart scans and the heart scans are measuring calcifications in the arteries of your heart. And it suggested that especially women who took higher doses of calcium supplements had more calcification in the arteries of their heart. Subsequently, people have also looked at the use of calcium supplements in the incidence of heart attacks and strokes, and they haven't found that association. And so, I know this is a bad answer, but we don't really know. And that's why, as I mentioned earlier, I think the consensus right now is trying to get as much of it as you can through your diet. And then whatever you can't get, taking a supplement is okay. And so a lot of times, when I go through somebody's diet, I'll say, yeah, it looks like you can get, 500 to 600 milligrams a day pretty consistently. So then why don't you take one calcium pill a day? The important thing to remember with calcium is that your body cannot actually, you can't take it all in one serving. Your body really can't break down more than about 500 milligrams at one time. And so that's why people were told, oh, take it 2 or 3 times a day and not once a day. And so, but I think that if you can get about 500 to 600 through your diet and then take one pill a day, I think that should be sufficient.
Okay, so is it a myth then that, some people will say that taking vitamins and supplements and minerals will just sort of kind of in and out of your system? You take it and you basically, pee it out. People say that it really doesn't absorb into your system. Is that partially true at all, or not at all?
I would say that it's partially true, right? So, so the idea with multivitamins is that especially if your diet is pretty well balanced, that you're probably peeing out most of that multivitamin. With calcium specifically, the reason why people are recommending calcium and vitamin D is, number one, we aren't getting as much through our diet as we used to, right? I mean, we're being told don't drink a whole lot of dairy. We don't drink nearly as much milk as we used to, like when I was a kid. And the same goes with vitamin D, but we're told not to go out in the sun. And so in some respect, we created our own deficiency to some extent. There's no question that even by taking that 1,000 milligrams or 1,200 milligrams of calcium a day, we're probably peeing out a fair amount of that that we take in of what is absorbed. But the idea is that we are able to keep our bones strong in the long run, and that's why it's recommended.
That makes sense. So our next question is from Katya, and she would like to know, what about calcium citrate supplements for osteopenia diagnosis?
Yeah, so calcium comes in a lot of different forms. Probably the most common form is calcium carbonate. But calcium carbonate, the problem with calcium carbonate is that if you do take acid pills, it will probably be a lot less effective than something like a calcium citrate. And so a calcium citrate is probably a good form of calcium to take for people who are on pills for stomach acid, or in people who just don't tolerate carbonate, because sometimes calcium citrate's a little bit better. Osteopenia is a reason to make sure that you get 1,000 to 1,200 milligrams of calcium a day, because you want to make sure you want to keep yourself from going from osteopenia to osteoporosis. And so weight-bearing exercise, adequate intake of vitamin D and calcium are really what we recommend for osteopenia, mainly to keep you from progressing more than anything else.
Right. Great. Thank you very much. Karen would like to know, what about probiotics, one for gut health, and what about the support and the use of probiotics? Would you give some suggestions on what you recommend we should take?
Yeah, so we know that gastrointestinal problems are very, very common, and we've now come up with diseases like small intestinal bacterial overgrowth. There's a whole science that's revolving around our gut microbiome. The problem with probiotics is we just don't have great evidence, right? There's been some evidence with probiotics and preventing certain diarrheal infections in patients who take antibiotics. Antibiotics are notorious for causing diarrhea, and some of it may be due to an infection, because we take an antibiotic, not only does it go get the bacteria that, for our sinusitis or pneumonia or whatever, but it also starts killing some bacteria, good bacteria in our gut. And so there's a little bit of data that if we take a probiotic, we maybe prevent that from happening, and continue that probiotic for maybe a couple of weeks after we take the antibiotic. There have been a few small studies on patients who do have things like bloating and all that, to take a probiotic, that maybe it will help a little bit. This is another case of we don't have a whole lot to say what to do. So I do talk to patients about trying it. There's a couple of them that I'll tell you. The first thing I tell them to do is, step one is maybe try a yogurt, if you can tolerate a yogurt with probiotic in it, as a step one. And do that daily, see how you feel in a couple of weeks. If you feel maybe a little bit better, but not a whole lot better, then maybe switch to a probiotic pill. And there have been a couple of probiotics that have been studied more than others. And again, I don't endorse any products whatsoever, but ones like Align, ALIGN, Florastor, FLORASTOR, have probably been studied a little bit more than some of the other ones. But for the most part, they all have a little different formulation of the active cultures in them. And so it's very difficult to compare them head to head without any real studies. So, a long answer to, we don't know. I don't have a problem with people trying if they're treating some symptoms, but is it going to really prevent a whole lot in the long run? No evidence of that.
Mm-hmm. Yeah, that's a tricky one, because that's another popular, everyone seems to be taking probiotics. They think they're being proactive, right, in their gut health and so forth and so on, but not necessarily, because it is killing the good things that we need in our gut. We need to be a little bit more careful, it sounds like, in taking that. Be mindful of doing that.
Yeah, and I think we will get to a point where we're going to be able to check everyone's individual microbiome in their gut, and perhaps be able to figure out what the right thing is. Some of the testing that's being done right now, I think is a lot of hocus pocus, but I think we'll get there.
Yeah, I bet we will one day. So Sharon would like to know, what are your thoughts on measuring vitamin D levels, and what are the optimal levels?
I will tell you that, so the United States Preventive Services Task Force will tell you not to check levels, and will tell us not to check levels. My problem with vitamin D levels is that it's pretty arbitrary. So about 10 years ago or so, it was a group of endocrinologists, bone specialists, who got together and said, hey, we should raise the normal from above 20 to above 30. And so, because we think that the incidence of bone disease goes up the lower your level is in general. And so they did that. And so now, if you were to check levels, like 90% of us are going to be low, and with 30 being that cutoff. The problem with vitamin D levels is they've also been calibrated and recommended for Caucasian Americans. And so anyone of color is going to run a lower vitamin D level, despite not having necessarily a higher risk of osteoporosis or bone disease. And so I always try to interpret a level based on ethnicity, and there are no guidelines with respect to that. My general rule is I want your vitamin D level in the mid-20s. I know there are, my endocrinologist colleagues will say, no, we want it above 30. I think in patients who have osteoporosis, I think that's a good target. I disagree with my colleagues and other people who say it needs to be above 75. I think there's zero evidence that that's the right thing to do.
Right. Well, listen, it looks like we're running out of time. We're getting near that 8 o'clock hour, but I have to tell you, Dr. Ashar, this was just wonderful information and just great information on all of these supplements. So we'll have to have you back again for sure. So
Thank you very much.
I would like to thank you, Dr. Ashar, very much, and for each of you for joining us this evening. And in the coming days, a video of tonight's live stream will be available on the A Woman's Journey website, hopkinsmedicine.org/A Woman's Journey, under Videos on Demand. And if you've enjoyed tonight's discussion, please check out our website, hopkinsmedicine.org/A Woman's Journey, for information about future programs, conversations, and podcasts, all featuring Johns Hopkins physicians and faculty, brought to you by A Woman's Journey. In the meantime, we hope you will find our monthly email informative and engaging. Good night and stay well.